If you or someone you know is currently dealing with uterine fibroids, you know how painful they can be. But what are fibroids and how can you treat them? Uterine fibroids are non-cancerous growths found in the uterus, and, ranging anywhere from the size of a pea to the size of a melon, these tumors can cause some serious problems. It's not uncommon to suffer from heavy, prolonged periods, severe cramping, pelvic pain, and frequent urination. But you're not alone. Though nobody knows exactly what causes uterine fibroids, between 20 and 40% of all women aged 35 and up are affected, and African American women are nearly 5 times as susceptible. Thankfully, it may be easier to treat than you realize. Non-steroidal anti-inflammatory drugs like ibuprofen can be taken to manage the pain, while hormone treatments like birth control can help to reduce the bleeding. Of course, these options aren't permanent and are not always effective. If medications do not provide relief to treat your fibroids, you'll likely need to undergo a procedure, and chances are your gynecologist has informed you of at least 2 such surgeries, hysterectomy and myomectomy. Now, unfortunately, both of these operations are rather invasive. A hysterectomy is the careful removal of the uterus, and a myomectomy is the surgical removal of the fibroids themselves. Both surgeries are proven to be safe and effective, but there's a risk of blood loss, you'll need several weeks to recover, and you'll have to take extended time off work. Hysterectomy also eliminates your chance of future pregnancy, while myomectomy carries some risks of infertility as well. Luckily, there's a less invasive alternative, uterine fibroid embolization, or UFE. A non-surgical and often outpatient procedure, UFE is designed to preserve your uterus and keep you fertile by blocking blood flow to the tumors, cutting off their source of nourishment, and halting their growth altogether. Uterine fibroid embolization is performed by a specially trained physician, an interventional radiologist, under conscious sedation. First, a small tube, called a sheath, is inserted into the groin. Then, a longer, thin tube, called a catheter, is inserted, and the radiologist maneuvers it through your body's arteries to the uterine artery and the vessels that surround your fibroids. Once in place, the radiologist will inject microspheres, like tiny marbles made of gel, through the catheter. These microspheres will fill the uterine blood vessels and block the flow of blood, starving the fibroids of oxygen and causing them to shrink. As your fibroids shrink, your pain and other symptoms improve. UFE gets right to the core of the problem. It treats your fibroids and leaves your uterus healthy and intact. And it does so with minimal risks and almost no long-term effects. There's no scarring, some women are able to maintain fertility, and blood loss, if any, is minimal. In fact, most women return to their normal activities within 7 to 10 days. With fibroids, it's important to know your options. There are several treatments to choose from, and it's important to understand the benefits and risks of each treatment. If you'd like to learn more about UFE, please consult an interventional radiologist. This website contains a physician finder that will help locate an experienced physician who can help you determine if UFE is right for you.